Sten, welcome to the show.
Hey, Boomer, thanks for having me.
All right, so we're gonna jump into a lot today, and for those watching this on YouTube, we actually have the same headset on, and we may get into a little bit about that headset in a second. But okay, blood flow restriction, and I've had the pleasure of talking to somebody very close to you about this recently. But what can't it do?
Yeah, so that's a good question, Boomer, because a lot of people think of BFR, blood flow restriction, as this miracle tool to use in any capacity, wherever you are, and it'll solve all your problems. What BFR really is a way to tap into the existing physiology that we have to adapt to stress.
Mm-hmm.
And by doing that, the way it does that is actually, in a way, tricking the body into thinking that it's undergoing massive loads or massive stress that then necessitates adaptation. So that adaptation can be increased muscle strength, increased muscle hypertrophy, increased blood vessel development, something we call angiogenesis, increased bone formation, all of these things that are normally associated with training. And really what BFR does is it taps into that and tries to augment any of those adaptations that we would normally see with heavy resistance training or high intensity training, such as running intervals and things like that.
Mm-hmm. All right, can we delve a little bit into the mechanisms here, just because
Sure.
There are quite a few biochemistry nerds that listen to this,
Sure.
myself included, and I would just love to understand a little bit more about why something so simple as restricting blood flow leads to such a massive adaptation.
Yeah, so one of the things that I've learned just in studying BFR and cardiovascular physiology in general is just how important blood flow is.
Mm-hmm.
Blood flow is so vital, and it might seem kind of mundane to say that, but it's really profound. The way that we move, the way that we operate, the way that our cells actually turn over and actually perform their function is through blood flow, getting oxygen, getting the nutrients they need, and then getting rid of those toxins and waste after energy is produced and those cells use up whatever nutrients were in the bloodstream. And so when we disrupt that blood flow, that normal flow going into and out of the muscle, into and out of the organs, we stimulate a stress to the system. And that stress then leads to adaptation. Any adaptation that you gain from anything, whether it's studying, whether it's even drinking, your body gets used to these things and tries to adapt to that environment. And so whenever we disrupt that blood flow, that's a major stress to the system in making it adapt. So really what happens when you have the cuffs on is, and the reason why we use light weights when we use BFR is to really recruit the fibers, the muscle fibers responsible for aerobic metabolism, right? They need oxygen in order to produce ATP, in order to initiate muscle contraction and cross-bridge cycling. When we do those light weights, normally we can pretty much do it all day. So think of even just an unweighted bicep curl. We can pretty much do that all day. When we don't have sufficient blood flow going to that muscle, it gets further and further into trouble. And by trouble, I mean it's using up that oxygen, it's not clearing out the waste products associated with creating ATP, and you end up having to recruit more and more high threshold motor units. And those high threshold motor units are innervating your type 2A and type 2X fibers, which are kind of responsible for explosive power and sustained explosive power. Mm-hmm. And so as you start tiring and fatiguing your type 1 fibers, two things are happening. You're running out of oxygen, you're running out of blood, and you necessarily have to recruit those type 2 fibers. And those are, like I said, they're innervated by higher and higher threshold motor units. So that's coming from the brain. So the effort in the intent in that exercise is also increased. And so we see hypertrophy of those muscle fibers, as well as some CNS developments in strength as well.
Mm-hmm. Now,
and so this process that leads to lower and lower oxygen levels, then again, subsequently recruits those muscle fibers. And that's really what we're trying to get at when we lift heavy weights or we're running maximally. We're just immediately recruiting those muscle fibers. With BFR, we're kind of getting there gradually.
Mm-hmm. You mentioned CNS. So you and I were discussing before about my past history of pounding my sympathetic nervous system.
Yes.
When I look at blood flow restriction training versus, let's say, some of the workouts that I used to do in sort of West Side splits with powerlifting, am I necessarily pounding it as much as I am with, let's say, 1 to 3 rep max deadlifts or something like that?
So that's a good question. Short answer is no. So
Mm-hmm.
this is a very different way to actually recruit those muscle fibers and stimulate even neurological adaptations.
Mm-hmm.
But we're not taxing the external load. The absolute load that you're subjecting your body to is so much lower that you're not stressing your CNS all that much, or I should say as much as a heavy weight, lifting a heavy weight.
Mm-hmm.
Um, you're still taxing it somewhat. And if you use heart rate variability, we can actually see that your sympathetic nervous system is turned on. We can get a little bit more into the mechanism of some nervous fibers that actually are stimulated by using BFR, but also when you're doing normal resistance training. And these things lead to a heightened sympathetic response.
Mm-hmm.
The real key with BFR, is that although we're stimulating that CNS, that sympathetic response during the workout, the parasympathetic post-workout is actually elevated. And so not necessarily during the workout is all that different. You're still, having a heightened sympathetic response, but it's really that the fact that you didn't actually subject your body to high external loads that you can recover so much more quickly.
So you mentioned a couple of adaptations that happen. Neurological adaptation, I'm sure a few people perked up when they said that. Does BFR make me smarter? Or is that just, or like, does it help muscles communicate better in that sense?
Does it make you smarter? I think it's still kind of
Maybe that's
not
something to
determined
be
yet.
found in the lab.
Yeah. TBD. Okay,
Mm-hmm.
but it certainly helps develop neuromuscular strength.
Mm-hmm.
So the way we kind of think about that in the exercise physiology world is, really this goes out to all the guys who want to look good for the beach. If they don't start training a month and a half before they want to look good and lean out and build some hypertrophy and build some muscle, they're kind of doing themselves a disservice. Really, any gains in strength that happen within the first month of training are really neuromuscular.
Mm-hmm.
And so essentially you have more myelination on your motor neurons. Those signals are being sent more efficiently, and also the same amount of stimulus at the neuromuscular junction elicits a higher force of contraction. So that's kind of the initial training and adaptations that occur, and then you can get hypertrophy after 6 weeks and beyond of training.
Okay. I'm going to table the 6 weeks and beyond of training for a second, because I want to drill down a little bit more on the nervous system point.
Sure.
How does that work? Because you mentioned that, yes, I am taxing my sympathetic nervous system, but is there an asymmetric response with the parasympathetic nervous system afterwards when you uncuff yourself? Or if you don't mind going into that a little bit.
Yeah, so, and this is still a little bit up to discussion. There aren't too many papers out there looking at specifically parasympathetic and sympathetic responses. So I want to be careful here and let people know that this is purely speculation.
Okay.
So the way that I've kind of tried to think about it is, because you have the external loads being low, your parasympathetic response after the workout is going to occur faster than it otherwise would when you're subjecting your body to actual muscle damage and high load stress on your joints. So it's your body kind of picks it up as two very different things, and allows your body to recover faster to get you into parasympathetic state. But so something to kind of like tease apart here is we have our sympathetic responses, and you have afferent neurons going up to the medulla and then being processed there through efferent neurons. You then have a sympathetic output, and that includes increased heart rate, increased sweating, increased blood pressure. The list goes on. What happens when we have the blood flow restriction bands on is, as we're doing that, we're stimulating that sympathetic response, but it's more so to do with the restriction of blood flow rather than the actual external loads. And so as soon as we remove that blood flow restriction, all of a sudden your body is working very, very well, and you can recover that much faster. I hope I answered that question adequately.
Yeah. Absolutely. Well, look, I put you on the hot seat there, because
that's okay.
It's something that I've kind of wondered, because we're going to get to frequency of training later.
Sure.
But there's my traditional thinking around training, especially in the powerlifting world, is that you need a little bit more of a break than you may need for blood flow restriction.
Right.
Uh,
Before we go on, I want to kind of tease apart two things too.
Yeah.
So neuromuscular development and motor neuron recruitment and myelination of those motor neurons is completely separate from the sympathetic response.
Okay.
So you have motor neurons, somatic motor neurons going to your muscles, and they're innervating those and causing the muscle contraction. But you also have your autonomic nervous system, and that gets split into your parasympathetic and sympathetic nervous systems. And so they're kind of two separate things. They play with each other a little bit, but they're very distinct pathways.
Awesome. Before we get into just a lot of things that you've done with athletes, et cetera,
Sure.
the other use cases of this, because blood flow restriction training to me, I've seen bodybuilders use it. I've seen a lot of people, and maybe not necessarily in the right ways, tying whatever cloth around their biceps.
Yeah.
But other use cases aside from just getting swole, what are some of the things that you've seen in your experience in terms of using this, maybe in a physical therapy sense?
Yeah. So the way I like to think about BFR is it's an augmentation of whatever training you're normally doing. So what happens with a given workout is we either maximally or we submaximally stimulate a series of hormones that are released in response to the magnitude of stress that workout induced. So on some days when we have an interval day or a 1 rep max day where we're building up to a 1 rep max, it's a maximal day. You're probably not going to get a lot more augmentation of that adaptive response with the use of BFR. However, on the days where you have a more moderate intensity day or even an easy day, you can use BFR to maximally stimulate that anabolic response from those exercises. And we can get in a little bit into how that actually works, why you can up the frequency of your given workouts a little bit later. But that's kind of the gist is we normally have this ceiling of our anabolic response to a given workout. And BFR is kind of a way to make sure that we're closing in that gap and kind of reaching that asymptote on that curve. And it does this by tricking the body into thinking that it's a maximal stress, and our response is to maximally adapt. So that's kind of the gist of why we're seeing it can work for hypertrophy, but also if your focus is physical therapy, aiding in that healing response. So doing a fatiguing set of exercises, which you really normally can't do if you're really all that injured, helps the body adapt. Exercise in general is anti-aging. It's a robust healing adaptation, or causes robust healing adaptations. It builds better blood vessels, which again, coming back to the idea of blood flow being so vital, more blood vessels equals higher rates of healing and higher rates of fitness.
And let's talk about growth hormone, because growth hormone to me, and I think there's been studies on this, is sort of like looking at it from an epigenetic age perspective and sort of reversing that epigenetic age. With BFR, I could, in theory, induce significant amounts of growth hormone. Is that right?
Yes. So just to back up here, because I think it can confuse people. BFR doesn't elicit a higher amount of growth hormone than you would normally produce with a maximal exercise session.
So if I don't produce growth hormone, a high level of growth hormone normally, it's not like you're adding, let's say, SARMs or something to the equation. It's not it's not like a replacement for, or it's not an addition to your normal growth hormone.
Yeah. The way that we kind of talk about it is endogenous production of growth hormone versus exogenous production, right? Or exogenous.
Thank you. That's probably what I could say, right? Like that's probably.
But that's kind of how we break it down. And so you only have so much endogenous growth hormone that you can actually release. However, especially for people who, like you said, who are maybe getting older and have less endogenous production of growth hormone, the other side of that coin is that a lot of times they're not able to get to an intensity that would elicit a maximal endogenous release of growth hormone. And so this is a good way, an easy way, or I shouldn't say easy, it's still pretty tough when you have the bands on.
It's pretty damn difficult.
It's a faster way, a slightly more effective way for that population, let's say, to elicit a maximal growth hormone release.
hmm And so when I think about other use cases like sarcopenia, which is
Hmm.
a huge problem in the elderly,
Huge.
and
Yep.
then osteopenia and osteoporosis, these all seem very, very logical, and it contributes to bone density as well, right?
Yes, and there's the verdict is still kind of out on that, whether it increases bone density. But in a few of our case studies that we've looked at, we have seen increases in bone density. And
Hmm.
actually, interestingly enough, this was in a woman who was osteoporotic.
Okay.
So she was actually able to increase her bone density during an aggressive, I think it was two-day BFR session over 3 weeks,
Hmm.
which is almost unheard of with someone who's osteoporotic. You mentioned sarcopenia. So that's a huge problem for our population right now, particularly the baby booming population, which is the majority of our population.
Hmm.
And actually in Japan, where this kind of originally developed, they use that as a standard practice for dealing with symptoms of sarcopenia, dealing with symptoms of osteopenia and osteoporosis as well. So really, it's I think in my opinion, it's just a matter of time before American clinicians really are able to see this and are exposed to this enough to see the true benefits of it and really start implementing it for their patients.
Hmm. So we were on one end of the spectrum with the
Sure.
physical therapy side of things. Now, you've had some experience with some pretty damn high level athletes.
Mhm.
How does a high level athlete use this and how does it contribute to their training?
Yeah. So when we talk about high level athletes in general, it's totally variable. So everybody has their specific exercises they like, level of training that they like, and so it's going to be there's no kind of one stop shop answer for that. What I've typically seen is especially once someone is kind of established at the elite level, say they're in their 30s, they're just maintaining. They've kind of done the hard work the past 30 years and are just looking to maintain their level, and do that in an efficient way. And so a lot of the times they'll use this as a complete replacement for their normal strength training.
Hmm.
And part of the reason they like that is, as they're getting a little bit older, they tend to get a little bit more sore from heavy lifting. Um, they just they don't feel the need to do that type of lifting anymore because they feel just as strong using BFR. I've also seen, if we kind of looking a little bit more on the younger side in elite athletes, using it in conjunction to their strength training sessions, but also, for example, some Olympic downhill skiers have been using it while they're on the slopes, um, for very
That's
brief. Go
like,
ahead.
is that just one run or because that to me seems you're on the slopes and these guys aren't exactly on the greens, right? Like
No,
they're taking
they're
something that's a
flying down the
little
hill.
pretty steep in a squat. That seems extremely fatiguing. So
It
is
is.
this their entire training session, or is it just like you get done your run, unclip, and then go back up?
Yeah, so it totally depends.
Hmm.
It's a little bit variable. Um, some days, so what will happen is some days those skiers will do a normal interval session, maybe cut that in half, and then
Hmm.
do 2 or 3 sessions with the bands on. So they've kind of stimulated that initial adaptation that they want, and they're trying to augment it with a little bit of extra BFR in that very sport specific manner.
Hmm.
Um, Alternatively, if someone's coming back from injury, they may start on a less steep or less intense groomer run, and be able to use the bands and really get a very similar feeling of fatigue that they get when they're on that ice sheet going at a 45-degree angle down the slope.
Hmm.
And so it's a safe way to kind of gradually get back in while maintaining the relative intensity of that exercise.
Okay. Okay. So all right. Let's go back to some of these Olympic style athletes or that high of a level. When they're combining this in their workout, is it pre or post, or is that completely athlete dependent? And I guess maybe go through a use case on when you just kind of mentioned pre why you would do it, but
Sure.
post why would you do something like this?
Yeah, so it's a good question, and just like all exercise in general, it's very athlete dependent.
Yeah.
We have our principles of training, and we have our principles of the rates of adaptation in that time course, micro, meso, macro cycles, right?
Hmm.
Um, at the same time, it is going to be athlete dependent. However, I have seen a lot of success with athletes using this as a warm up routine,
Hmm.
and again, a little bit, this hasn't really been looked at in the literature at quite as much, but what we have noticed is just a little bit more proprioception after you do a warm-up routine with the bands.
Mm-hmm.
There's something about getting blood flow into areas that take a little bit more time to actually get perfused with that blood. I think part of it has to do with reaching an optimal muscle temperature. A muscle will contract optimally when it's heated up. Literally,
Mm-hmm.
warming up is a thing in the exercise physiology world, and doing that with BFR gets you there a little bit quicker. When you have blood flow going to an area, it's the best way to heat up a muscle.
Mm-hmm.
And so it kind of that resistance or that restriction forces blood into areas where it would otherwise take more time to actually get into. And part of that reason is a balance between your vasodilating and vasoconstricting capacity in the muscle, and its ability to kind of dilate and actually get blood flow into muscle fibers themselves. And so that's kind of the pre. A good way to talk about the post is, again, coming back to that idea of kind of reaching your anaerobic or your anabolic ceiling, rather.
Mm-hmm.
So if you were to use this after a day of moderate intensity exercise, you kind of maintain, the actual cost of that exercise is slightly catabolic, versus one that's very intense where you're going more catabolic. You have to dip down further into your stores to then build up.
Mm-hmm.
What BFR does is on those small days, you have a smaller catabolic response, but then you have just as much of an anabolic response.
Okay.
So over time, chronically, that can lead to augmentations in performance and muscle definition and composition as well.
Mm-hmm. Based on what you said, does that mean, like, let's say I'm trained for a bodybuilding competition, which I'm not, but let's say you are, would it be better then to have it post just to basically maximize your anabolic response in every workout?
Yes, I particularly for bodybuilders where the goal is to build as much muscle as fast as possible, I think that's probably the best way to do it. Go through your normal workout with the idea of inducing hypertrophy, getting a nice pump from that workout, and then really polishing it off. We call it topping it off with a BFR workout, where you're going to get even more of a pump. You're going to get more cell swelling. You're going to stimulate mTOR and muscle protein synthesis even more so than you otherwise would. Again, talk about diminishing returns. When you get to the upper echelons of that maximal ceiling of an anabolic response, how much more is going to give you? That's really the question. That's kind of what each athlete and each trainer needs to ask themselves. So if you're already kind of doing that, maybe that BFR can provide that extra 1 or 2%, which ends up being the deciding difference between high-level athletes and high-level bodybuilders, I should say.
Yeah, Mr. Olympia in second place, right?
Exactly. And although I'm not saying that that's going to be the key difference, it's one of the many aggregate gains that you can add to your training to help get you there.
You mentioned mTOR, and that's a fairly trendy pathway in the longevity world. Is there any concern with this that when you're looking at older populations, I guess on the one hand, you're balancing this delicate, you're on this delicate balancing act between avoiding sarcopenia and overactivating mTOR. Is it a concern that you could overactivate mTOR if you do this too much?
So, and I see where you're going with that, because overactivating mTOR can lead to cancer, right?
Yeah.
Cancerous cells. So the thing with exercise that's really interesting, it's a major regulatory stimulus for the body. And so thinking about mTOR that way, it's a little bit different. With exercise, and again, I'm a little bit speaking off the cuff here. Cancer is not my expertise, so I want to kind of iterate that before I go on. But having said that, normally we think of oxidative stress, superoxides, also stimulating mTOR, because basically mTOR is a response to stress, and one of those stresses is oxidative. So that can come from food, it can come from environmental factors. Exercise is a very acute flood of basically oxidative stress, but within certain limits, right? So you wouldn't be, it's bad for you to be exercising 24 hours a day. It would not be good for any part of your system, but really short bouts of exercise can be really positive for adapting the body. And so mTOR with regards to cancer is a little bit different of a mechanism than mTOR being activated by exercise per se. So that was kind of a long-winded answer to answer your question, but I think it's
It was
important
very
to make
helpful
it.
because it was just
Yeah.
like something that came top of mind. I'm like, whoa, mTOR. Okay.
Yeah, and so really, so mTOR can lead to cell proliferation, but exercise itself is a great regulator of all cells, and so
Okay.
you can have that cell proliferation rather, but you can also have exercise inducing apoptosis, which is essentially trying to get rid of damaged or uncontrolled cell growth.
Um, what about it allows you, and I guess maybe I should clarify this before I go ahead and make the statement, but can you train with this 7 days a week, or do I need to take a break?
So I would say it depends. For you, someone who trains pretty regularly, you can get away with training 7 days a week. And theoretically, there's nothing stopping anybody from training that frequently. Again, getting back to the idea of a minimal effective dose, do I think it's required to train 7 days a week?
Yeah.
Probably not.
Mhm.
But the nice thing is you can. So, and those days might look different. You might have a little bit more intense session 3 days out of that seven, and a little bit lighter sessions on 4 of those 7 days. But yes, you can do this every day. There won't be any negative consequences associated with it. I will say when starting out, it's kind of a better idea to limit it to 3 to 4 times a week. Your body it's a big stimulus, it's a big stress. So it's better anytime you're introducing any new training system or methodology, you just want to gradually go into it. You don't want to jump in head first. So that's kind of the caution I would kind of give out. But yes, because we're not inducing a whole lot of muscle damage, we can up the frequency of training by a lot.
Do you have, in that elite athlete level, do you have people that use this every single day of the week, or that actually work out every single day of the week? Or because recovery is so important to this, and sometimes recovery equals the stimulus, right? And so when you have an elite level athlete, are they using this once, twice a day, 7 days a week, or is it just more looking at like how much is this person sleeping?
So again, with anything else, it's going to be a little bit dependent, right? But those elite level athletes, depending on their training phase, whatever phase they're in of the year, they can use this 7 days a week, 1 to 2 times per day. And actually, just as a way for me to stay in shape and stay healthy, I use this every day as well. And I've used this every day for the past probably 2.5 years, probably more like 2 years. And again, so not every day looks the same. It's not like I'm maximally exerting myself every time I put the bands on, but even a little bit of stimulation of growth hormone and that kind of thing will help just me feel better throughout the week. The other thing that people tend to notice when they start using BFR is they sleep a lot better. And so for people who have trouble sleeping, this, even just doing a light intensity workout with BFR can help them fall asleep. And part of that has to do with growth hormone. Part of that has to do with just the regulatory element of exercise itself, stimulating energy and kind of having that kind of up and down effect of the nervous system as well.
Fascinating. If there hasn't been any study on that, I would love to participate in it, because that would be a fantastic thing to run.
Exactly. I think there needs to be way more research on how this affects sleep, because especially for athletes, what we've noticed, and for us, it's kind of interesting, the scientific world, a lot of the time the researchers already know whether or not something works. And it's just a matter of creating a study in order to actually get at that answer and see if it actually does work on paper.
Yeah, I've had a few strength training coaches on the podcast before, and they always like to comment that science catches up with strength training. I'm not sure if that's actually true, but it's kind of, who knows, right?
Well, so that's actually a good conversation to have, just really briefly, because
go for it.
That is somewhat true. A lot of strength coaches, a lot of just coaches in general, right, whether it's running, triathlons, things like that, will implement things that they know work and have worked over the course of their careers and history. And what ends up happening is we as researchers then take that and say, okay, this seems to work for them. Let's see if it works in the lab in a very controlled setting. And sometimes it does, and sometimes it doesn't. The other thing to consider is, for something to significantly be affected, it has to have a substantial increase. And for athletes, 1 to 2% increases are substantial. But they may not be statistically significant when we're looking at it in a lab. And so sports tend to be kind of on the cutting edge of whatever methodology is being put out there. And it could be 15 years ahead of the research of the science. Textbooks are usually about a decade behind where the research is. And so if you're ever reading a textbook, they're great. And you should realize that there was a lot of work that went into all that text. But at the same time, they're great for kind of getting a foundational understanding of the physiology or of that science, but they're not on the forefront of that research. Then we have meta-analyses, which are anywhere from 6 to 8 years behind the current research. And then we have the current literature, recently published studies, which are anywhere from 2 to 3 years behind where the cutting edge is. Then you get to the conferences, and that's when ideas are shared. So like ACSM every year, you get to meet with other researchers and you get to talk about what they're doing in their lab, and it can help inspire and kind of veer people on or off course. And then you have kind of the sports world right there, which is on the cutting edge and looking at this in real time.
And that's just because people are really pushing the bounds and willing to do almost everything in order to take it to that next level. Is that right?
Exactly. Yeah. I mean, performance is the goal, and winning is the goal. So when you have that huge incentive, people are going to be looking for any way they can to get ahead and excel.
The idea of low weight, high reps is something that candidly I've struggled with, and it just sort of seems counterintuitive to me.
Yeah.
Let's start with the idea of, can I use blood flow restriction training in kind of max out workouts? Like, could you in theory do that? And maybe as a corollary to that question, why is high reps, low weights better?
Sure. So it depends on what the goal is for that training. What we define as an effective training session. Because on one day it could be, I just want to feel a little bit better. I want to feel like poppy and springy and ready to explode. On other days, it's like, I just want to be crushed by this workout. And so that kind of plays a part. But put simply, when we do low weight and high reps, we're getting at gradually recruiting those muscle fibers, like I kind of talked about at the very beginning of this. So we're really using our light intensity or our type 1 fibers to do the aerobic work rather, and then more aerobic work as we go down the line of muscle fibers. The reason why we want to use light weights with BFR is we're able to actually induce that. If we were to do light weights without BFR, it would take so many more reps to get the adaptations that we're looking for that it's impractical. And it's much easier to lift up something heavy, immediately recruit all of your muscle fibers and put it back down, right? The reason why we wouldn't necessarily want to do it with the bands is it kind of gets away from the benefit of using the bands. So whenever we have a high intensity or heavy load day, you tend to be pretty sore from that. And the reason why you're sore is the actual muscle fiber damage. So you have these micro tears, you have some leakage of potassium and calcium, and another oxides that create an inflammatory response. And really it's that inflammatory response, not lactic acid, that causes muscle soreness, right? And with BFR, especially when you start getting used to it, you don't have that muscle damage because we're using light weights. And so it just allows you to increase the frequency of training because you're not causing that damage. And so coming back to that chart where we have this catabolic cost to the training and then an anabolic response, we are now just dipping in slightly and still maintaining that anabolic response. So that's kind of the emphasis of why we wouldn't want to lift heavy with the bands. I would say that Bstrong is probably one of the very few bands that you can lift heavy with because we're not occluding arterial inflow to the muscle.
Well, let's talk about occluding, because I think this is a point where we haven't delved too much into it, because it is a danger. Do you mind explaining what that exactly means and what can happen if you actually do occlude the blood flow?
Yeah. So essentially, what we mean by occlusion training is you have two sources or two forms of blood, or I should say, it's all the same blood, but it's going through two different, we'll say,
maybe in some people it's not the same blood, but
right. So you have your venous blood flow and you have your arterial blood flow, right? Your oxygenated is the arterial, your deoxygenated, desaturated is your venous. And you have the arterial flow coming from the heart going into the muscle itself. You have the venous flow coming out of the capillaries that are in the muscle itself, and they actually have these one-way valves that we can talk about in a sec, and they're going to take that desaturated blood, and that has toxins in it as well from the muscle contraction, and they're going to take it back to the heart, going through the lungs, and then back out through the arteries. When we talk about blood flow restriction, at least as it was described originally in Japan, and what Bstrong uses is venous occlusion. So we're restricting the blood flow out, and that's causing a disruption of the normal blood flow circulation in general. When we place an occlusion pressure on the arterial side, and let me back up a little bit. The reason why we're able to do that and not affect the arterial side is because the arteries have a thick layer of smooth muscle that kind of protects them, causes vasoconstriction, causes vasodilation in order to kind of control blood pressure. That's the main way that we are able to control blood pressure. And veins have a little bit of that, but it's much, much less. You can look on yourself, you can collapse your superficial veins very easily. And so with a relatively low pressure, we just occlude the venous side of things while maintaining arterial flow. So blood pressure cuffs, rigid systems, it's harder to do that. And so you end up, the way that it's kind of been used in practice is they go up to an arterial occlusion pressure, and then they back off from there, anywhere from 40% of that occlusion pressure to 90% of that occlusion pressure. And that is fine and safe and effective as long as you're being supervised and your blood pressure is being monitored and you're in a clinical setting. It becomes an issue and perhaps dangerous when you're not in that clinical setting or not being supervised and you're on your own doing your own workouts. And again, I don't want to just dissuade people from using those, because I think they're they can be very effective, and especially for younger populations, like completely safe. However, for older populations, and especially people who don't really understand cardiovascular physiology, or people who are just kind of trying to use this as a way to just increase their fitness, I would proceed to those with a little bit of caution. And the reason for that is, and we can kind of stipulate on this, but it's not really well charted out. Really, what's happening when you restrict your arterial side is you're now messing with the flow into the muscle, and you can make that muscle ischemic. So there's no more blood going in that muscle, and while you're contracting on an ischemic muscle, that can cause really, really bad damage. And so something that can happen with that is something called rhabdomyolysis, which is essentially,
I'm familiar with that.
Have you had it?
Minor forms, not to the point where I had to go to the hospital or anything.
Right. So that can happen when you occlude the arterial side, because you're literally making that muscle ischemic, low blood flow and low oxygen, and you're getting in trouble, and you can start creating even more damage. Something that also happens. So think about when a heart attack occurs. Yes, the ischemia that you're creating in the cardiac tissue, in the myocyte, or cardiomyocyte rather, that ischemia is not necessarily what does the most damage to the heart when you have a heart attack. It's actually the reperfusion of blood flow as they clear out that blockage. All of a sudden you get this rush of superoxides and oxidative stress that causes inflammation and damage. So one of the things that can happen when you occlude your arteries when doing blood flow restriction is actually that reperfusion. Now, because that muscle was super ischemic, it's created all these superoxides within that, and then you get a rush of even more oxides into that area, and that's when you create a kind of a positive feedback loop of damage to that vessel and the muscle. And so we try to avoid that by using a system that purely tries to attack or kind of limit the venous outflow. And before we move on, one thing I want to kind of clarify is the reason why we're able to occlude the venous side and not the arterial side is through something called these one-way valves in the veins themselves. And so as we have this thing called the skeletal muscle pump, so as we're sitting there not doing anything, blood flow is not getting past that venous blockade, not getting past the dam. That's affecting how much blood is coming in from the arterial side, by the way. So once you hit kind of a threshold where those two pressures are equal, you'll start having some venous flow going across that band. But you're also slowing down the arterial flow without actually contracting the vessel itself. So you are still getting a little bit of arterial restriction, but it's because the dam is being backed up, not because you're compressing that artery itself. And so each time you actually contract, your muscles contract and force blood, all of a sudden your pressure here is increased. And all that blood has to go is one way because of these one-way valves, and that forces the blood past the blockade. So if you're at home and you're thinking about this, you may experience that your blood pressure feels better in your arms when you're actually doing the exercise rather than just sitting there. Sometimes when you're just sitting there, you're like, oh my God, my arms are about to explode. And then you start doing the exercises and that feeling goes away. What's happening is your muscles are actually forcing that blood past the band intermittently. So you're still getting a restriction of blood flow, but you're able to get that out intermittently in a safe way.
Wow. Okay.
Pretty cool.
Aside from giving everybody else a moment to digest that, like I need to digest that a little bit.
Yeah.
Let's take it over into like the practical side of things, because we have a lot of people here, not practical, that's the wrong word, but like the how we would use this in everyday life. And we have a lot of people here using this, or they just don't have that much time, right?
Yeah.
As I've mentioned to you before, kind of two populations. You have the actual people who are trying to be superhuman, and then the people who are like, okay, what is the minimum effective dose? What does a workout look like for this, for people who are in that minimum effective dose camp? Because you and I both, we were chatting earlier about time constraint, right? And how sometimes like, hey, you may only have 20 minutes in a day or less. What does a workout look like with Bstrong?
Yeah, so the way I think about it, my non-negotiable for the day, right? My non-negotiable workout, if I'm super busy, you always have 5 minutes, right?
Yep.
And so what I typically do is a little circuit. I'll put on all 4 bands. I'll do max number of pull-ups, max number of push-ups, max number of air squats. Then I'll do that. I'll cycle through that 3 times. In about 5 to 7 minutes, I am completely toast, but have gotten my workout in for the day. So that's kind of how I use it. It's almost like a Tabata type session where it's really high intensity, but it's only body weight, so your actual loads are still pretty low. And that way you're able to boost a huge amount of growth hormone. You're able to get that anabolic response in a really short period of time. I don't want to fool anybody out there. It is still a very hard workout in that 7 minutes. But and the other thing you're doing when you do that is you're stimulating a massive EPOC. So something excess post-exercise oxygen consumption, right? So to replenish that huge oxygen debt that you've just created in your muscles, you then burn more calories after the workout's done. So just while you're sitting here working, you're actually your resting metabolic rate is higher, and you're burning more calories just sitting there to replace all of the energy that you just used up.
And how long is that window of EPOC afterwards?
So this is something, again, we need to look more into. But after a given exercise session, it can last up to 24 hours. Wow. I wouldn't say that that's what's happens every time, but you do, and especially, we have acute responses to this and we have chronic responses to this. And so if you're using this every day, you're kind of always stimulating that response, getting that out there, and getting the maximal adaptations that you can, versus an acute response, which can last from 5 hours to 24 hours, depending on the intensity of the training.
Okay, and I did cut you off there in terms of just talking a little.
That's okay.
Okay.
No, we're good.
So when we're talking minimum effective dose, okay, that was 5 to 7 minutes, right?
Right.
But if somebody were to take this and run this pretty much every day and say, this is my exercise, what kind of training splits would you look at for somebody who's more than an executive role? Is it upper lower? Is it full body all 7 days? How would you want to split that up?
Yeah, that's a good question. So the way I would say it is, start out gradually. So if you're just getting this equipment, maybe stay 3 days a week. Start titrating in one more day, one more session a day, kind of over the course of 2 to 3 weeks. Once you've gotten pretty used to this stuff, that's when I would put on all 4 bands. So again, maximal efficiency of use of time to evoke the maximal adaptation. Put on all 4 bands. The more muscle mass that is actually restricted is likely going to yield a higher adaptive response. And so I recommend putting on all 4 bands. doing a series of core-based exercises. So those core-based exercises can be push-ups, they can be pull-ups, they can be even squats while you're actually engaging your core, or have a weight, a 30-pound weight in your hands. That is what I would say would be most effective for someone in kind of an executive position. The other thing that I found, and just before this podcast, I just did a very quick 2.5 to 3 minute push-up and squat session, just to kind of get a little endorphin rush, feel ready and focused for this interview. And so I would recommend for those executives right before a meeting to do this, put the bands on. Again, the goal is not to get a huge amount of fatigue. It don't want to make you hypotensive or hypoglycemic because it was such a hard workout, but you're just kind of turning everything on and making you a little bit more sharp and able to articulate what you want to in that presentation or meeting.
And okay, now I want to transfer over into some of the more annoying questions that I asked you before we actually hit record. More in terms of if we're going to try and push that superhuman limit in terms of both cognitive capacity but also physical capacity, stacking workouts and using this device. We've touched on some of this already in terms of the before and after, but okay, the element of cardiovascular exercise. You did mention that people do use this downhill skiing, but how would you sequence, for instance, a cardiovascular exercise, maybe just for example, like a longer run with a Bstrong training session? Should it be before or after? And maybe you can throw out some variables in terms of things people should consider.
Yeah, so I think in order to kind of answer that, I need to provide a little bit of context. So most people think of training as like, okay, hard work in, results out. But really, what is the goal of that exercise session? What is the goal of your training program in general? Is it to build power? Is it to develop strength? Is it to get bigger and develop more hypertrophy? So these are all questions. Is it to get a little bit better? Is it to increase your VO2 max? So so each component, each phase of training, each focus of training is gonna elicit or necessitate a little bit different application of BFR. To go to your cardiovascular question, what I would do, so there's various goals of different types of training sessions. So generally speaking, the longer runs are really to develop the structure of the muscle and the tendons in the limbs in order to be able to handle the volume of training that is normally associated with running. People tend to think of running long, slow distance as, okay, I'm tapping into fat burning, right? If they keep their heart rate within a certain range, that's their fat burning range. And so for that, it's a little bit different. For elite runners and competitive runners, the reason why they would do long, slow distance is really to develop that muscular structure and coinciding with their tendons. The way that they induce metabolic stress, which is really what you're getting at with BFR, you're really increasing the intensity of metabolic stress. That's sort of saved for more interval training based days, or even fartleks, so longer speed intervals or versus shorter speed intervals. And that's where BFR can kind of augment those adaptations. So I would say if you're going on a long run, do that long run, maybe cut it at about 75%. So if you're on a 10-mile run, stop at 7.5 miles, put the bands on for that last 2.5. So that's going to do a couple things. You're going to get all the adaptations that you did from that long run, but then you're also going to induce a little bit more metabolic stress than you otherwise would by putting the bands on. I wouldn't recommend, and I've done this, so I know, I wouldn't recommend putting them on and running 10 miles. Partly because you're probably not getting too much more bang for your buck if you're doing that versus just kind of saving it for the last 2.5 miles of that 10-mile run. And the other thing is you can actually get pretty sore with that. And the reason for that is it's a relatively eccentric motion running, right? So you're lengthening the muscle as it's contracting, and that can create tears more easily. And so when you have a pressurized system while you're doing those micro tears, it tends to make it a little bit worse. So kind of keep that in mind when you're doing longer distance.
Would that be the same with sprinting? Because should you wear this with sprinting, I guess is the question.
So again, kind of that's the other end of the spectrum. And what I tell people is I would perform all your explosive movements without the bands at as high a velocity as you possibly can. And then if you want, use the bands to get a fatigue signal to augment what you just did.
Mm-hmm.
But there's not in my mind, there's not a huge benefit to using the bands while doing maximal sprint training.
Mm-hmm.
Now, having said that, if you're at like 75% or 70% or 60% of your max speed, that's where I think you can actually make your muscles think that you're at maximal speed, and you can do some of those adaptations without incurring a lot of stress and high intensity on your actual system. So kind of coming back to the idea of lighter weights, higher reps, in the form of running, sprinting versus not sprinting.
Mm-hmm. Yeah, just as an aside, I have a bike back there which does take you to maximal levels when it comes to bike sprints. And
Sure.
I did put the Bstrong bands on, and this was nobody's suggestion but my own, and try to max out on those sprints. And wow, the next day was a fun experience. It was just like, wow, I need a walker kind of thing.
Yeah, exactly. And again, there's nothing wrong with that, but you always have to come back to what is the goal and focus of your training, and that kind of thing. And hey, if the goal of your training is to feel like a bag of sand after, because I know guys who are like that, I just want to feel something. That's a good way to do it. And I don't know if I want to ask you a little bit about that training session, because did you notice that you got to fatigue faster, or that the fatigue was just more intense?
Both, in the sense that if you look at it, because the device, which is behind me, actually maps out your fatigue. And so you can see like the max point I hit was actually lower than what my typical one or
in terms of wattage.
Yeah, in terms of wattage. Exactly. And then the fatigue towards the end of the 20-second sprint was significantly higher than what it typically would be. And so and I assume that all just has to do with the blood flow restriction, right? And
exactly. Yeah. And that's actually, so you bring up a really good point. Your wattage is an assessment of your power, right? And you weren't able to get to the same wattage than you did without the bands. So that's kind of what I'm getting at when I say kind of save the bands for after you do your maximal power output, because you still want your body to be used to stimulate or being able to generate that much power. But you also can use the bands to kind of augment that, whatever process you're doing. And that's why, so there's kind of a titration process with how you think about how to titrate Bstrong or BFR into your workouts. And so one of the things that we think about with power training is you want to elicit that max power, but you want to minimize that cost associated with it. Yeah. So as soon as that power starts coming down, you want to throw the bands on, because you've done the power work. Now you're trying to get the muscle to fatigue and elicit a maximal anabolic response.
I love the analogy that you've come back to again and again with that catabolic cost and the anabolic response, because it is an asymmetric catabolic cost versus anabolic response, and that's the beautiful way of putting it. Coming back to
so just to elaborate a little bit on that, that's generally how we try to think about a training state for a given athlete. If they're constantly being broken down, it's really hard for them to bounce back up. Yeah. And so especially at the elite level, as coaches, that's what we try to titrate and balance, is that whole process. And BFR allows us to kind of, it's almost like a little cheat for a hack for coaches, because it allows us to have that anabolic response without as much cost. And that's really the fundamental balance. It's going to be different when we're working with a youth athlete who's still developing versus an athlete at the top of their game. It's really just a matter of balancing those two processes.
I love it. And I could throw it in my luggage, which is just fantastic.
Exactly.
Coming back to just BFR in general. So blood flow restriction has been around for how many years now?
So the guy, Dr. Sato, who first came up with it, was experimenting with these about 50 years ago.
And so why has it taken so long to become, it's not even mainstream now, but like, why is it taking so long to get to this point?
Yeah, it's a good question. It's something I kind of ask myself a lot too. So first of all, it was originally developed in Japan, and honestly, it is quite widespread there. They're using it a lot of hospitals, a lot of professional athletes are using it. They even have beauty shops where older women can go in and kind of just talk and do lightweight exercise and they think it's invigorating and things like that. So it's pretty widespread there. What ended up happening with BFR moving to the States is there's a little bit of loss in translation. Where it first kind of started developing is bodybuilders started seeing people using Katsu in preparation for shows. And, you know, a European bodybuilders would kind of go up to them and be like, so what's this all about? And some of the Japanese bodybuilders didn't want to give it away. So they like, oh, I don't understand you. You know, it's like, I can't converse.
Yeah.
And so they really wanted to kind of keep it secretive for themselves because they thought it was such a cool biohack. And so the European bodybuilders just started wrapping tourniquets around their arms and doing it that way. So it's actually in the bodybuilding world, I'm sure people are like kind of laughing right now because they're like, oh yeah, we've been doing that, you know, 30 years ago. And so it kind of went from that to then started being incorporated into the research as more studies were coming out of Japan. And the things that were available to those researchers were things like blood pressure cuffs, which, you know, wide rigid systems that don't allow for that skeletal muscle pump to really push the venous past the venous blockade that we were talking about earlier. And also years before this, back to 1930s and 40s, they had experiments where they would do post-exercise ischemia, limb ischemia, where they would exercise. They were trying to identify something called the mechano-metabo reflex or exercise pressure reflex, which is through afferent neurons, you get feedback to your central nervous system. They get integrated and you have an increase in sympathetic output to basically optimally deliver blood flow. And so that's kind of where it went to. That's kind of where people's minds went to, is this occlusion post-ischemia experiments. And so that's what people started doing. And then it kind of picked up speed when it was used on veterans, where they were going up to limb occlusion pressure and backing off. But it's in that process, the traditional techniques and protocols kind of got lost in that path. And so the original Katsu is really getting at venous occlusion, not arterial occlusion specifically, in order to elicit that fatigue state. Whereas now the literature has kind of gone to, okay, let's use blood pressure cuffs to very accurately assess blood pressure during, you know, different positions in order to restrict arterial flow going into the muscle. So there's been a little bit of a discrepancy in that whole kind of journey of coming to the United States. Why it's not getting as much traction, I think it's just a matter of time. I think people still, you know this as much as anybody, coaches really like to depend on what coaches in the past have done. And so they're very averse to going after new techniques. And I would say, like, again, the kind of the younger generation of coaches is picking up on this. And I think certainly the circles that I'm in, everybody, BFR is kind of exploding in popularity. So I think it's just really a matter of time before it really starts picking up into the mainstream. But I think that kind of story of how it came over gradually, it definitely plays a part in why it's not really literally exploding right now.
And in terms of the Bstrong device itself, when you look at the innovations that were made around it that prevent the occlusion and some of the other, is it specifically the air tube, or is it something, because you see the bodybuilders that just basically take a bandana or something and tie it as tight as they possibly can. The innovations that you guys made on the device in order to just make it that much better. Can you talk a little bit about that?
Yeah, so I will say the device was really designed with the original Katsu protocol in mind. So really trying to stay away from any arterial occlusion while maintaining venous restriction or occlusion. When you tie a bandana or like a elastic band around your arm, you can have an effective BFR session. The problem is you don't know how that's changing day to day. There's no pneumatic actual pump that is telling you what your pressure is for that day. You're really going off subjective feeling. And on top of that, there's going to be areas where the band is tighter and looser. It can pinch nerves and arteries and things like that, and it can be dangerous. But I will say, if you've had experience with this, and bodybuilders out there who are doing this, while I don't necessarily recommend it, it can be effective. So I don't want to take that away. But what really makes Bstrong stand out is this barrel system. And With Katsu, you actually have the band itself is elastic. It's kind of an elastic material, whereas when we don't have any air inflated in the band here, it's non-elastic.
Yeah.
Right? As soon as we inflate air, if I can find it, give me one sec.
Got one right behind me.
So as soon as we inflate the air, these barrels will start to inflate. Okay. So a couple things are happening. First of all, think about this on your arm. These bands are now kind of pressing into your tissue. But because due to fluid dynamics, your blood is going to be eventually going to be able to push down on this air in order to get past it. So a couple things happen. You get that constriction and kind of compression of the tissue, but then all of a sudden this becomes an elastic band. And I encourage people who can't really see this to try this on their own. You actually have elasticity in the band now. And that's kind of what separates the use of bandanas or blood pressure cuffs from this design, because we're able to have a semi-elastic, non-elastic band that provides enough restriction to restrict the venous side, but stays away from the arterial occlusion.
Where do you think blood flow restriction training is going in the future? And if you're able to hint on what you guys have going on, sort of the research and development side, I'm sure the listener base would love to hear.
Yeah, so kind of two parts to that. I think, at least in the circles that I've seen here in Austin, some of the performance centers, and certainly in the PT realm, BFR is almost at this point standard procedure. So I think, in the next 5 years, this is going to be a must-have for every gym and every PT clinic out there, just to be able to keep up with other PT clinics and gyms that do have it. I think the real expertise is going to be how to actually implement that, because there's a million and one ways to actually do that. So that's going to be kind of the limiting factor, I think. But yeah, so I'm very optimistic about the future of BFR, whether that's Bstrong or other products in general, as a way to really help the population get fitter and stronger. Another application, this kind of gets into the research that I'm going to do, but another application is for clinical population. So people with type 2 diabetes, people who are aging, even people who have musculoskeletal or neurological diseases such as MS. This is a great way for them. Normally they can't really do exercise, period. It's very, very hard for them. So this is a great way for them to be able to get moving and actually maybe start that process of rehabilitation or prehabilitation. So one of the studies that we did at UT was, and this is unpublished, so can't speak too many details about it, but we were prehabbing cancer patients for surgery. Okay. There's a very strong correlation between lean body mass and rates of or lower rates of mortality post-op for cancer patients. And so our goal was to build up these cancer patients, get them some good lean body mass in order to be able to handle the surgery better. And so that was one application. They couldn't have increased their lean body mass really with a normal training program, mainly because it would just be so taxing, and they can't lift heavy weights, so it would be with light weights anyway. So we were thinking of a way to induce a similar response using light weights they can handle in a more efficient and effective way. Some other studies that we're doing, I've mainly looked at the safety aspects of and really the hemodynamic or your blood pressure responses during a BFR session. And in my study, we were looking at really the difference between wide rigid cuffs and narrow elastic cuffs. For the wide rigid, we used a cuff called a Hokinson cuff, which are pretty normally found in lab environments. It's essentially a blood pressure cuff, rapid inflation, so you can have really precise control. And then we use Bstrong as kind of the narrow elastic component to compare it against. And given the same walking, actually the wide rigid cuff was actually at 160 millimeters of mercury. The Bstrong bands were pumped up to 300 millimeters of mercury. Even so, with that large difference, we saw major increases in blood pressure when using the wide rigid cuffs. And while that may not seem like a huge finding, pretty obvious, it does have implications for use of BFR in clinical populations or in unsupervised settings, right?
Mm-hmm.
So again, coming back to what I said earlier, I think that wide, rigid blood flow restriction, occlusion training, that kind of stuff can be effective. We're still getting at the idea of tricking the body into thinking it's doing high intensity, high load work. But it needs to be monitored very carefully in order to make sure you're not going to cause any adverse reactions.
So if you're a person who's already predisposed to high blood pressure sitting at home, this by themselves, it's probably not the best idea to tie off your arteries and go.
Exactly. However, BFR and particularly Bstrong and even in Katsu, I would say, great way to try to treat hypertension.
Yeah.
And exercise in general, because and a lot of people will say, well, isn't it dangerous to increase your blood pressure when you're already hypertensive? Well, yes, if that's sustained for 24 hours, but little bouts of increased blood pressure actually help you lower your blood pressure, desensitize your baroreceptor to have you have a little bit lower blood pressure in general. So, that's something to kind of clear the air a little bit when it comes to exercise. Yes, the actual event of exercise is very stressful in the body, but really it's that stress that then leads to adapting to be more healthy for the other 18 hours in the day.
Brilliant. Sten, this has been an absolute pleasure, and damn, my head hurts. Education. It's great. I want to transition now into a final few questions.
Okay.
What is your top trick for enhancing focus?
Well, I think that's very relevant to what we're discussing today.
I wonder, because you did something beforehand.
Yeah. So I whenever I'm feeling a little bit sluggish, like if I'm just feeling like my adrenals are kind of like loaded and just feeling maybe inflamed, I'll put the bands on and just do a very short 2.5 minute kind of flush. And so it'll be, one exercise, again, not looking for fatigue necessarily, but just kind of getting my body turned on. That helps. I practice meditation quite a bit. And actually I've experimented with having the bands on and inflating and deflating while I'm meditating. And that actually I've noticed, especially comparing that with some breath work, is actually a really nice way to focus and kind of kick those thoughts that you're trying to get out of your head, or, as they say with meditation, you kind of let those thoughts, those anxious thoughts or whatever thoughts you're having kind of float away.
So walk me through this, because you've seeded 2 of my favorite things, right? Like meditation, 3 of my favorite things, breath work and blood flow restriction.
Yeah.
How are you're manually inflating and deflating during this meditation session?
Yes, exactly. Okay. So what I do, I'm lucky enough to have more than one pump. so I have 2 pumps in my hand, and I'll usually just start with my arms. I'll have all 4 bands on, but I'll start with my arms. I'll inflate, again, kind of be kind of in a meditative state, working on box breathing. So whether it's 2-2-2 or 4-4, it kind of just depends on how I'm feeling that day. But I'm working on that and working on diaphragmatic breathing through the lower end of my stomach, or my abdomen, I should say. Inflating, staying inflated for about 30 seconds, releasing the pressure for about 5 to 10 seconds, inflating for about 30, and kind of using that as a way to induce that meditative kind of response or state, meditative state rather. People tend to think of like, okay, focus on your breath, count in, count out. This way I can kind of focus on my blood flow itself and really narrow my focus into that. And then I notice if I do that for about 10 minutes after, I just feel very clairvoyant and ready to tackle the day.
Wow.
To kind of finish that protocol, after I do about 5 inflation deflation sessions on my arms, I'll move it down to my legs and do the same with my legs. And then I'll deflate everything, take the bands off, and sit there for another 2 to 3 minutes.
The benefits of being a part of the company, right? You can have the extra.
Exactly.
I'm gonna try and figure out how to run it with 1 pump. But what excites you most about the health world right now?
Yeah, good question. Well, I think what excites me the most, especially being on the kind of the research part of things, is realizing how much we don't know. I think that's maybe an antiquated statement of the more that you dive into something, a given topic, the more you realize that you don't know. It's very true when it comes to physiology and health. So I just, the prospect of learning so much more about the body and how much I've learned in this short time, just in terms of how important, for example, blood flow is your whole system, not just your cardiovascular system, but to your ability to think, your cognitive function, your metabolism, the way that you actually degrade and break down nutrients, absorb nutrients. It's all so connected. And so I would say like that's the kind of the coolest, nerdiest aspect of physiology for me is just how integrated the system is. And I think that's studying that integration is going to be where the health department, health institutions kind of end up going.
Book which has most significantly impacted your life?
That's a good question. So I recently read 12 Rules for Life by Jordan Peterson. And I've listened to the audiobook as well. I was recently in a car ride and I kind of listened to that the whole way down, and had some really, really good stuff in there, and almost to a point where all these things I'd kind of already known, but he does a really good job of articulating them in a palatable way, and really helps you. It's kind of, people call it a self-help book, but I also like to think about it as almost like a life hypothesis book, or life like goal kind of book. It's a good way to look at life and kind of take responsibility for your actions and take reins of your own life, rather than kind of blaming other people or kind of having this victim mindset and things like that. So that's definitely kind of informed a lot of my ideals and things like that.
Where can people find out more about you and Bstrong?
Yeah, so I'm a little bit hard to find on the internet, but you can look me
You're
up.
hiding.
Yeah, I'm hiding. No, not intentionally. But they can find out more information if they look up UT Kinesiology Department. I'm in there. Right now I'm in Clinical Exercise Physiology Laboratory at UT. I was in the Cardiovascular Aging Research Lab, so that's kind of where my main focus is. But I'm working with a company called Reach Outcomes right now. So it's a performance center. We're looking to kind of integrate all the aspects of performance. So anything from recovery to sleep, nutrition, strength and conditioning, physical therapy, all that under one umbrella. If they want to kind of look me up on there. Anybody in the Austin area, if you're looking to enhance your performance or have a little bit more direction, that's another good place to kind of find out more information about me. In terms of Bstrong, I'd kind of direct people to our website, bstrong.training.com. We can find out there's tons of information that we've posted on there, whether it's from the mechanism to how you can use this in your own applications, to how to put the bands on, as simple as kind of understanding what the bands are all about. You can find a lot of information there.
Awesome. Sten, thank you so much for joining. This has been an amazing education, and I really appreciate it.
Yeah, it's been an honor. Thanks for having me on, Boomer. I hope we can do something in the future.
Absolutely. To all the superhumans listening out there, have an epic day. And when you're watching this, subscribe to the YouTube channel, because you're going to watch videos like this all the time. Thank you, Sten. Appreciate it.
Awesome. Thanks, Boomer.